Support for Arkansas Week provided by the Arkansas Democrat Gazette, the Arkansas Times, and Little Rock Public Radio.
And welcome to Arkansas Week. I'm Dawn Scott. Thanks for being here. The U.S. is honoring the men and women who have served in the armed forces. Veterans Day is Saturday, with the State Veterans Day ceremony held Friday at the State Veterans Home in North Little Rock. On this edition of Arkansas Week, we are discussing issues facing veterans and the resources available to them. And joining me right now in studio, three officials with the Central Arkansas Veterans Healthcare System. First, Dr. Robert King. He is the Associate Chief of Staff, Primary Care for the Central Arkansas Veterans Healthcare System. We also have Laura Watlington. She is a licensed clinical social worker. She is also the Suicide Prevention Program Manager, something very important to discuss related to veterans. And we also have Crystal Pearson. She is a registered nurse with the system's Special Operations, Public Health, and Safety Clinic. To all three of you, thank you so much for being here. The VA has expanded healthcare benefits over the past year, including treatment for veterans who were exposed to toxic substances like Agent Orange, radiation, and burn pits that were common spaces to dispose of waste in places like Iraq and Afghanistan. So that's what we're talking about today. It's called the PACT Act. And I first want to start with you, Dr. King. How did this law come about and what does it entail?
So this is very important legislation that came out from one of our state senators, significant lobbying to ask for more benefits for our men and women who have served.
And what does the PACT Act entail when we're talking about those burn pits and radiation that these veterans could have been exposed to? Is that the impetus for this new law? Is that where it started?
Absolutely. There are both a requirement for expanded screening for all veterans in the state of Arkansas and the country. And there is a new presumptive diagnosis list that links service connection to medical conditions that servicemen and women may experience.
And I see you, Crystal, you're nodding because as a registered nurse, I imagine you're in front of veterans that may or may not have been exposed. What does this look like?
So basically, the PACT Act, its name in essence is just the reason that we started it and that the law has been passed. It was named in honor of Sergeant First Class Heath Robinson. And the name of the PACT Act is actually Sergeant First Class Heath Robinson, honoring our promise to address comprehensive toxics Act of 2022, which is known as the PACT Act now. So the law was passed in August of 2022. It expanded healthcare a significant amount for many of our veterans, all the way back to the Vietnam era, for many of the toxins that they have endured. So when it was passed, it not only expanded healthcare benefits, but it also expanded geographical locations that our veterans may have been exposed, as well as the numerous types of exposures. And then, like Dr. King said, over 20 additional presumptive diagnoses.
Well, this must have been a huge win for you as a clinician to have probably been seeing it already and to finally have the support and names for what you were seeing in your clinical practice.
Absolutely. Yeah, it definitely has been. It's been very eye-opening. And as my role with our clinic is basically we have began working with primary care to do toxic exposure screenings, which are part of the law. And the law makes us as clinicians accountable for making sure we're asking the questions. And we're trying to rewrite the narrative of VA healthcare to include a more comprehensive frontline approach, where in the past that hasn't necessarily been done so well. And in doing so, the law it's guided us and encouraged us to work with outside entities, including Veterans Benefits Administration, as well as the other departments within our umbrella of the VA.
Well, you mentioned adding in numerous diagnoses. What are these conditions, and what does it look like if, in terms of a patient presented to you?
Sure. This is information that's provided to the healthcare teams so that they can be aware. And what we ask is, instead of focusing on the quite extraordinary list of expanded conditions, that veterans really enroll and they reach out. We are doing a proactive job of screening folks and letting them know of these new opportunities to expand their benefits. But there are some veterans in the state of Arkansas that aren't yet enrolled, and we ask them to reach out to us so that we can enroll.
What does the exposure look like in terms of say a patient coming in? Is there a behavioral aspect to it? I know, because we will touch on mental health here greatly in a moment, but I'm curious what it looks like if a person may or may not have been exposed. How would they know?
So basically, the law, when it was passed in August of 2022, it did these presumptive conditions like we're talking about, right? And what it looks like for those veterans that are heavily involved is a lot of respiratory issues, secondary to the open burn pit exposures, the sandstorms, and all of those things that our armed forces folks experienced over in the Middle East. And so a lot of times we get all of these respiratory issues, and this law actually requires our practitioners and our healthcare providers to kind of ding, ding, let's relate that. Maybe we need to go ahead and do a pulmonary function test. Maybe we need to go ahead and do an x-ray. Maybe we need to look into this shortness of breath further. And that helps prepare the veteran for later if they decide, yes, I need to file a claim. I do think this is related to my service time. And so all of those pieces of the puzzle really kind of come together for the veteran because of this law.
Interesting. And so you mentioning the sort of physical symptoms, but I imagine there are also emotional or mental symptoms as well to some type of exposure.
Yes, definitely. I think that anybody who's suffering from a physical illness, that can definitely affect their mental health issues. Especially if they're going untreated, if they think that it was caused during their duty time and the VA is not acknowledging that. And so that can affect people's mental health up to the extent of actually causing suicidal thoughts. Mm-hmm. Not everyone's going to have the suicidal thoughts, but addressing their health care and their physical care is a step in the right direction. That is part of suicide prevention.
I read that in this new law that it recognizes this toxic exposure as a cost of war, and I think that's huge. If you would speak to that.
Well, it is important for our country to understand and acknowledge that the servicemen and women, after they have served, may have health consequences afterwards, after their service. So the PACT Act is a step in that direction. And getting back to your question, some symptoms are evident and some symptoms aren't. And that is just something for the healthcare system to be aware of over time to keep an eye out for.
And you mean silent? They just haven't shown themselves yet, or just there's not a physical component to it just yet?
Both, yes.
Yeah.
Both.
So both of those. One of the biggest things that we've seen with our Gulf War veterans is an increase in respiratory cancers, ear, neck, throat cancers. We've seen a huge increase in that. And part of the PACT Act also, it requires us to do research and follow up with that research. And so when talking to veterans, you realize that there's some resentment toward the VA at times for previous generations because things weren't recognized quickly. Well, that's where the research aspect comes in. We have to do the research. We have to know that they're experiencing these problems or we cannot address it. The cost of war significance is that with these presumptive illnesses, all a veteran has to prove is that they were there during the time period and we assume responsibility. What that means is we're going to assume we caused that detrimental thing to them. Yeah. And that's that 23 conditions that have been in addition to. It didn't take away anything from healthcare. I think it's important for veterans to know that as well. The law just expanded. I think a lot of our veterans get confused and they think, oh, well, they're going to take something away now. No, this is an expansion. It's the largest expansion to a healthcare system in 30 years in the United States.
Interesting. You bring up such a good point with the resentment from generations past and just really a lot of upset there. And maybe, Crystal, you can speak to that, just sort of a distrust or maybe even misunderstandings with what veterans feel versus what now you are able to offer.
Right. I don't know if we want to get into the PACT Act. It's a similar acronym. We're talking about the PACT Act, but the PACT Act is another one that we wanted to discuss today. That was just passed in January of 2023, and that allows any veteran who is in a suicidal crisis to present to any emergency department for acute suicidal crisis care. The eligibility criteria are wide open on that. There are fewer restrictions for one to utilize PACT Act than there are for regular VA care. And so it's important for our veterans to know that if you are in a suicidal crisis, please go get help. Please go and tell them that you're a veteran and that you're wanting to utilize the PACT Act, because if they don't tell them that they're a veteran, VA can't be aware of it, and so we need the communication. Another thing that our veterans can do, if they're having trouble getting their needs addressed, whether it's medically or mental health, they can call the 988, the Veteran Crisis Line phone number. Oftentimes people think they have to be in a crisis to call that number, and I always want to encourage people, call before you're in crisis. Call if you're not getting through your healthcare system or through your healthcare provider. We have a team of people who are there and ready to respond and help you navigate the VA system, which it's a big system, and it's got a lot of components, and it's really hard to navigate if you don't know what you're doing. And so you can always call 988, press 1. That's the same number that was the National Suicide Prevention Lifeline, the 800-273-8255. That's now 988, just to make it an easier number, but the 800 number is never going to go away. So people can call that.
And I want to come back to this topic in a moment, but back to what you were saying with regard to the previous generations and sort of the resentments and mistrust. Is this, does this open up coverage to where it is paid in full? There's nothing out of pocket for veterans coming in with this, with the PACT Act?
That's correct. So the presumptive illnesses expand coverage and those benefits for care of those conditions. So whether it be in the VA, and we hope that veterans choose the VA, or whether it be in our community partners, their care will be covered.
And I want to just making it clear, if you are a veteran out there, to hear this is so important, to just know that you can be screened, know that this could bring extra coverage to you. What is the screening process and what does it look like?
So basically the screening process is really very simple. It's 3 questions. Did you serve? Do you feel like you've had any exposures during your service time? If they say yes, then you respond with what kind of questions do you have? What kind of medical or health concerns do you feel like you have now that maybe you wouldn't have had you not been exposed to that toxin? And then we go ahead and we give them the steps. We provide them the map of how to navigate the system. And it's so much more about resources and giving them information and just having the conversation with them than anything. It's more about just making sure that you hold their hand so that they can get through the system without any of the stresses that we've been known for in the past.
Yeah. And this is as easy as a phone call, or locations all across the state? I think we do have some a phone number to get screenings, 501-257-6020. It's on your screen there, and we'll keep it up for a moment, but it is as simple as a phone call.
Absolutely.
Yeah. And then a series of questions that follow, and then followed up with the veteran coming in.
Yes, the veteran can come in. We provide them with the phone numbers, the working phone numbers, the working phone numbers, and the correct people to link into to get those benefits that they definitely deserve.
So you mentioned respiratory, potential shortness of breath. What else would you be looking for? And if you're a family of a veteran watching, I think it's just so important that we just provide this information of what symptoms that may seem odd that are likely part of the list of what you're looking for.
Sure. Well, there are a lot of musculoskeletal related illnesses and injuries, and GI illnesses and injuries that have been expanded for the PACT Act. So really it's more about getting screened and getting in to see the healthcare professional to do a detailed history and physical exam. And we're very much open and looking forward to seeing folks that haven't used their VA benefits.
What has the response been so far?
It's been massive. So we've done, I think nationally, the report that I saw the other day was where we have completed like 60-something% nationwide of our enrolled veterans. As we move into 2024, we'll be expanding that outreach to reach our unenrolled veterans more so, but we in Central Arkansas, we have already began that outreach process, and we've really taken more of a boots on the ground approach and kind of taken our toxic exposure screenings and PACT Act knowledge out on the road to our rural veterans especially, because we want to make sure everybody has the access to health care. And so when we're doing that, we make sure that they have a primary care physician, as well as their information regarding the suicide prevention and things of that nature, and have been working diligently with both of those departments to ensure that we're covering all of those bases.
It's so interesting to me, just the messaging that this is not another negative that maybe you might have seen or experienced in the past. This is a way to truly help. Am I wrong in reiterating that?
This is a total positive, and it's an opportunity for people to get the care that they need, and that they earned over their service to the United States of America.
I want to move now. You briefly touched on the Compact Act, and these, this is so important too, because we know that people who have served are at higher risk for suicide, for mental health conditions. Yes. And speak about that, if you will. Where do we stand in Arkansas in terms of numbers?
Numbers.
Just people attempted suicide, mental health conditions and diagnoses.
You hear the number 22 suicides per day. That would be national number. You hear that number thrown around a lot. And based on better statistics, better data, a much more comprehensive set of data, they discovered that it was more like an average of 20 per day, which again is terrible. It's a terrible number.
Just among veterans.
Just among veterans. So veterans are about twice as likely to die by suicide than civilians. And so they really are at a higher risk. And that's not even if they've been to combat. They don't have to have been to combat to have the higher risk. Our veterans, as we're talking about here today, they get exposed to extreme conditions. And that in itself can cause mental health issues, but if you have a chronic health condition, anybody with a chronic health condition can have some mental health issues surrounding that, just because of the stress of it, especially if you can't get it diagnosed correctly, if you're not able to get the treatment that you need for it. And so expanding these services is a huge impact. I always find that just getting our veterans full care can reduce their mental health symptoms. And on top of that, we do have a number of evidence-based care provided for mental health. We have a lot of very specialty services that we are able to offer that aren't necessarily available in the community. And so our veterans have the option sometimes to be seen in the community, but we always want them to come to the VA, since we have our specialists in these areas.
What are some of the things that you offer that, like you said, aren't available in the community?
Say if you have PTSD, we have a domiciliary that's a 28-day inpatient stay for a veteran who has PTSD. And so that's just something that other places don't have. We have an outpatient PTSD clinic that focuses on evidence-based care strictly for, PTSD diagnoses. On top of that, we have a homeless domiciliary. We have a substance use disorder domiciliary. And then we have outpatient services for all of those things as well. We've got the suicide prevention team, which sounds like mental health, but actually suicide prevention is something that our facility promotes throughout the entire facility. And so everybody in our facility is assessing for suicide, doing the screening that's either positive or negative. And then, if it's a positive screen for suicide, then they are referred to an LIP or a licensed independent practitioner for a more thorough screening.
You said something a moment ago. You said even veterans who had not been to combat are still at higher risk for suicide. Why is that?
I think that just the experience of going through military service. I've talked to a lot of veterans, and that surprised me. I'm not a veteran myself. I've been in the system for about 11 years, and I was surprised by that as well. I thought you have to see combat in order to have suicidal thoughts. But no, there's a lot of dangerous places that our troops go to that can still see death. Even if it's not a combat situation, they can still see death. They can still go through extreme experiences. And so that's not a really clear answer, but it's just what the statistics have shown.
What can family members, and we talked about this with the PACT Act, but with mental health specifically, what can family members watch out for as well? Sometimes you can be in a mental health crisis and sometimes not have great awareness about it. It's
Correct.
just a general state of upset.
Correct.
Or beyond. But what could a family member potentially watch out for, and can they call?
Absolutely. Your family member can call 988 on behalf of your service member. Always press 1 because then you'll be sent to you'll be able to get sent to a VA facility. The phone call will be. But look for, changes in behavior. Are they starting to do some really risky stuff? Or is it just a different type of personality that they're showing? What kind of things are you seeing in your family member that might be different? Have they started drinking and using drugs? Any kind of change in behavior, sometimes one or the other by itself isn't cause for concern, but if you're starting to see a significant number of changes, it's worth talking to them. It's very important for everybody to know that you don't have to be trained in mental health services, or you don't have to be a trained mental health professional to intervene on somebody who might be in suicidal crisis. Anybody can talk to another person, showing kindness, sympathy, genuine listening skills. All of those things can go a long way toward one individual who's having a suicidal crisis. Even if they don't say they're suicidal, you might be able to reduce it. So it's important.
Well, often they don't. Would you agree with, no one, I've read much about this, and of course had veterans too in my own family that have suffered as well. And it's more something that you watch than you talk about, I think.
And that's one of the largest strengths of the VA is our interconnectedness. We have a very close relationship with the toxic exposure screening, with suicide, PTSD, and stress screening all throughout the organization. So we have in our primary care, we have patient-aligned care teams, which is an entire team that takes care of the veteran, and they have an integrated behavioral health provider readily available to help navigate mental health issues if they're identified.
Interesting. It goes hand in hand, though, I can see. The Compact Act, the PACT Act, both of you all working together, and your teams, of course, working together, treating an individual, not necessarily one diagnosis or condition.
Correct. We have to treat the whole person.
Right.
We have
And
an
the
entire
family,
system.
everybody
And the family.
together, yeah.
Sure.
And you said 988 and press 1 is the Veterans Crisis Line.
Yes.
Is that just to make sure that everyone out there watching, it's on our screen right now, 988 and press 1. And sometimes there's shame attached to this too. How do you address that with veterans? People are often proud and they don't want to admit weakness, especially someone who may have been to war.
Right. You'd be surprised at the humility that we've been able to see through a lot of veterans. I think with the younger population, the stigma is reduced to a large extent, but it's the older veterans who are, number one, at higher risk, because I think they are less willing to discuss having mental health issues. So if somebody does call the crisis line, they should be met with kindness and listening, and it can be a way that they can get help without having to talk to their family or without telling their friends, hey, I'm going to the VA for a mental health appointment. But 988 can be used anonymously with great success and without having to admit to needing help. But we always want to say, there's an old saying they used to say was, it takes the strength and courage, of a hero, of a warrior, to ask for help. So it takes the strength and courage of a warrior to ask for help. So, another one of the big VA campaigns is don't wait, reach out. So we're really trying to just reduce the stigma that it's okay to need help. You know what, everybody that we see in our lives, I bet almost everybody needs help with something, and so I think just everybody having the conversation, reducing that, asking for help when you need it, and just being vulnerable.
We are coming to a close, but we do have a few minutes for just final thoughts from each of you. And Crystal, we'll start with you. Just either on the PACT Act, on Compact, anything you want to say to anyone that may be watching. I know we are a rural state, so access.
So access is super important for our particular state. We do want to make sure that people know that we do have different kind of options as far as transportation. If you feel like you just don't have a way to get to us, if it's for that mental health care appointment or if it's for a primary care appointment, we have resources to help with that as well. And I was going to touch on what she said about the crisis line and everything. It's real important just to keep it out there in front of them, because that phone call gives them a screen.
Yeah.
You know, they're not right in front of you. They don't feel as naked as you would when they're just on the phone. And so it's a really good opportunity to, like she said, just hit them before they get to a complete crisis point. And that's just my opinion, though. But at any rate, the exposure screening, the toxic exposure screening, of course, you can call for those. If you just have questions about how the benefits may affect you, you can call us as well. Dr. King's got a phone number for us regarding eligibility questions and things like that he'll share. But we are out there. I mean, if you have a community event going on, just like today at UCA, we are there.
We're
so
there.
we hope to see you.
Suicide prevention is also there.
Yes,
so I'm
ma'am.
glad you mentioned that. There's a lot of community outreach. There are veteran events going on all the time. And VA, we have so many different programs that make every effort to attend them, to meet the veterans where they are. Because sometimes, you know, they don't want to come to us first. But if they meet the people and see who we are, it's a good opportunity to open the doors to the VA for our veterans.
And Dr. King just confirming 501-257-6020 to call for screening. So
That's correct. And for eligibility, it's 257-5656.
5656 257 5656. Dr. Robert King, Laura Watlington, and Crystal Pearson, thank you all for discussing our veterans today. We salute all veterans out there this weekend and, of course, celebrate and honor you and the service that you have given to our country. I'm Dawn Scott. Thanks for being with us for Arkansas Week. We hope you have a wonderful weekend and a great week ahead.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and Little Rock Public Radio.